Hey everyone, welcome back to our channel. If you're new here, please subscribe. I'd really love that. If you're returning, how are you today? Uh, we need coffee, possibly chocolate. If you smoke, get them. You know, this is one of those. Uh, oh yeah, and Backyard Rebel, saw your comment. Here you go. You are wise ass, but I love you. I'm not really going to do that on camera. I hope you do realize that. Okay. Ladies don't do that. Anyway, so I need coffee, and then we're going to discuss. Okay, and there's a lot to discuss here. Okay, there's a lot. But first, let me give you an update, okay, on everything going on here. I will do a video on the outside so you guys can see. Sean helped me on his days off with the house, and the house is now done. It is completely painted, so I was so thankful for that. So he helped me, as he says, he put his man pants on. And he helped me so much. I swear, he's so awesome. Andrew will be calling any day. You know, he gets Liberty on Sundays. So, and then we'll be going up to see him. And then he goes to MCT training, which is infantry training for 18 days. It was 29 days, but they cut it back to 18 days, you know, because Rona. And then he goes to MOS school for 3 months, but they might cut that back as well. So we're really not sure, you know, so he might be home a heck of a lot sooner than expected. So, which is really awesome because, hello, I miss my son. So, but the house is almost done, really. There's a few more things that I want to get done, you know, flooring wise. I want to finish my ceiling. I don't know if you guys ever realize, if you look up at the ceiling, I had gotten a bright idea one day because I hate popcorn on the ceiling, and I scraped it all off. And now I have to paint my ceiling, which is a pain in the butt. But I have to do that now too. So, but I had scraped it off like 4 years ago. Yeah. Anyway, but this that I want to discuss is something that was sent to me. We had actually discussed something like this last year, and it was a law that New York tried to pass, and they tried to pass it quite a few times, and it never got through. But this, I didn't read it yet, so I don't know if it has anything to do with New York. So this, I don't know. I really don't. Okay. And this is a document. okay? And it presents considerations from the perspective of the CDC for implementing the shielding approach in humanitarian settings as outlined in guidance documents focused on camps, displaced populations, and low resource settings. This approach has never been documented and has raised questions and concerns among humanitarian partners who support response activities in these settings. And the purpose of this document is to highlight potential implementation challenges of the shielding approach from CDC's perspective and guide thinking around implementation in the absence of empirical data. And considerations are based on current evidence known as the transmission and severity of the Rona and may need to be revised as more information becomes available. Okay, so what is the shielding approach? Well, this, I will say, is a little long. Okay, so I don't want to try to like squish it down or anything like that, because if I do that, it may not be understood. You know what I mean? You don't want to try and like take words out and things like that, because then you'll be like, well, I don't understand, I don't get it. You know what I mean? So let's just I'll try to explain it the best way that I can. So this shielding approach aims to reduce the number of severe cases by limiting contact between individuals at higher risk of developing severe disease and the general population, which is low risk, like high risk, low risk, okay? High risk individuals would be temporarily relocated to safe or to like green zones. Okay, so think the movie Songbird. Okay. Now, these green zones established at the household, neighborhood, camp, sector, or community level, depending on the context and setting. They would have minimal contact with family members and other low-risk residents. And current evidence indicates that older adults and people of any age who have serious underlying conditions are at higher risk for severe illness from the Rona. So, take me, for example. My heart, right? I have a weak heart. I've been on medication for God knows how long. You know what I mean? Like things like that. Like, I guess if like you're diabetic or, epileptic or whatever the case may be, okay? Take serious medical issues, okay? In most humanitarian settings, older population groups make up a very small percentage of the total population. For this reason, the shielding approach suggests physically separating high-risk individuals from the general population to prioritize the use of the limited available resources and avoid implementing long-term containment measures among the general population. Now, in theory, shielding may serve its objective to protect high-risk populations from disease and death. However, implementation of the approach necessitates strict adherence to protocol. Inadvertent introduction of the virus into a green zone may result in rapid transmission among the most vulnerable populations the approach is trying to protect. So, a summary of the shielding approach described by FAVAS, FAVAS, is shown in Table 1. So, I can't save the picture. Okay, so what I'm going to do is I'm just going to read it out to you, okay? So Table 1 is a summary of the shielding approach, okay? It says household level, okay? And it's a specific room or area designated for high-risk individuals who are physically isolated from other HH members or household members, okay? Now, movement and interactions. Low-risk HH members should not enter the green zone. If entry is necessary, it should be done only by healthy individuals after washing your hands, using face coverings. Interactions should be at a safe distance, approximately 2 meters. Minimum movement of high-risk individuals outside the green zone. Low-risk HH members continue to follow social distancing and hygiene practices outside of the house. Now, neighborhood level. A designated shelter group of shelters, max 5 to 10 households, within a small camp or area where high-risk members are grouped together. Neighbors swap households to accommodate high-risk individuals. Movement and interactions, same as above, so same as the household level, okay? Now, next level is camp sector level, okay? And this is described as a group of shelters such as schools, community buildings within a camp sector, max of 50 high-risk individuals per single green zone, where high-risk individuals are physically isolated together. Now, the movements and interactions. One entry point is used for exchange of food, supplies, etc. A meeting area is used for residents and visitors to interact while practicing physical distancing, 2 meters, no movement into or outside of the green zone. Now, operational considerations. The shielding approach requires several prerequisites for effective implementation. Several are addressed, including access to healthcare and provision of food. However, there are several prerequisites which require additional considerations. Table 2, which I'll read to you, presents the prerequisites or suggestions as stated in the shielding guidance document, column 1, and CDC presents additional questions and considerations alongside these prerequisites. Now, Table 2 suggests prerequisites per the shielding documents and CDC's operational considerations for implementation. Suggested prerequisites. As stated in the shielding document, each green zone has a dedicated latrine bathing facility for high-risk individuals. Now, the considerations as suggested by the CDC are: the shielding approach advises against any new facility construction to establish green zones. However, few settings will have existing shelters or communal facilities with designated latrines, bathing facilities to accommodate high-risk individuals. In these settings, most latrines used by HH are located outside the home and often shared by multiple HH, which is household members. If dedicated facilities are available, ensure safety measures such as proper lighting, hand washing, hygiene infrastructure, maintenance, and disinfecting of the latrines. Now, the next one is ensure facilities can accommodate high-risk individuals with disabilities, children, and separate genders at the neighborhood camp level. This is interesting. Now, suggested prerequisites, as stated in the shielding document, to minimize external contact, each green zone should include able-bodied, high-risk individuals capable of caring for residents who have disabilities or are less mobile. Otherwise, designate low-risk individuals for these tasks, preferably who have recovered from the confirmed Rona and are assumed to be immune. considerations as suggested by the CDC. This may be difficult to sustain, especially if the caregivers are also high risk, as caregivers may often will be like family members. Ensure that this strategy is socially or culturally accepted. Currently, we do not know if prior infection confers immunity. Now, suggested prerequisites. As stated in the shielding document, the green zone and living areas for high-risk residents should be aligned with minimum humanitarian standards. Considerations as suggested by the CDC, the shielding approach requires strict adherence to infection prevention and control IPC measures. They require uninterrupted availability of soap, water, hygiene, cleaning supplies, masks or cloth face coverings, etc. for all individuals in green zones. Thus, it is necessary to ensure minimum public health standards are maintained and possibly supplemented to decrease the risk of other outbreaks outside of Rona. Attaining and maintaining minimum sphere standards is difficult in these settings for the general population. Users should consider that provision of services and supplies to high-risk individuals could be at the expense of low-risk residents, putting them at increased risk for other outbreaks. The next one. Suggested prerequisites as stated in the shielding document. Monitor and evaluate the implementation of the shielding approach. Now, this is more considerations, okay? Monitoring protocol will need to be developed for each type of green zone. So there's going to be different green zones. Dedicated staff need to be identified to monitor each green zone. Monitoring includes both adherence to protocols and potential adverse effects or outcomes due to isolation and stigma. It may be necessary to assign someone with the green zone if feasible to minimize movement in and out of the green zones. Now, as stated in the shielding document, again for these suggested prerequisites, men and women and individuals with TB, severe immunodeficiencies, or dementia should be isolated separately. Here's more considerations. Multiple green zones would be needed to achieve this level of separation, each requiring additional inputs and resources. Further considerations include challenges of accommodating different ethnicities, socio-cultural groups, or religions within one setting. Community acceptance and involvement in the design and implementation. Even with community involvement, there may be a risk of stigmatization, isolation, separation from family members, loss of freedom, and personal interactions may require additional psychosocial support and structure systems. Now, see section on additional considerations below. Okay. High-risk minors should be accompanied into isolation by a single caregiver who will also be considered a green zone resident in terms of movements and contacts with those outside the green zone. Protection measures are critical to implementation. Ensure there is appropriate, adequate, and acceptable care of other minors or individuals with disabilities or mental health conditions who remain in the HH if separated from their primary caregiver. Green zone shelters should always be kept clean. Residents should be provided with necessary cleaning products and materials to clean their living spaces. High-risk individuals will be responsible for cleaning and maintaining their own living space and facilities. This may not be feasible for persons with disabilities or decreased mobility. Maintaining hygiene conditions in communal facilities is difficult during non-outbreak settings. Consequently, it may be necessary to provide additional human resource support. Now, green zones should be more spacious in terms of other shelter area per capita than the surrounding camp sector, even at the cost of greater crowding of low-risk people. Ensure that targeting high-risk individuals does not negate mitigation measures among low-risk individuals, physical distancing in markets or water points where feasible, etc. Differences in space based on risk status may increase the potential risk for exposure among the rest of the low-risk residents and may be acceptable or impracticable considering space limitations and overcrowding in many settings. The shielding approach outlines the general logistics of implementation: who, what, where, how. However, there may be additional logistical challenges to implementing these strategies as a result of unavailable commodities, transport restrictions, limited staff capacity, and availability to meet the increased needs. The approach does not address the potential emotional, social, cultural, psychological impact for separated individuals nor for the households with separated members. Additional considerations to address these challenges are presented below. Oof. Okay, here we go. Population characteristics and demographics. Consideration. The number of green zones required may be greater than anticipated, as they are based on the total number of high-risk individuals, disease categories, and the socio-demographics of the area, and not just the proportion of elderly population. Explanation. Older adults represent a small percentage of the population in many camps. In humanitarian settings, approximately 3 to 5%. However, in some humanitarian settings, more than 1/4 of the population may fall under high-risk categories based on underlying medical conditions, which may increase a person's risk for severe Rona illness, which include chronic kidney disease, obesity, serious heart conditions, sickle cell, type 2 diabetes. Additionally, many camps and settlements host multiple nationalities, which may require additional separation. For example, Kakuma Refugee Camp in Kenya accommodates refugees from 19 countries. That's interesting. I didn't know about that. Timeline considerations. Consideration plan for an extended duration of implementation time, at least 6 months. Explanation. Wow. The shielding approach proposes that green zones be maintained until one of the following circumstances arises: sufficient hospitalization capacity is established, effective V for therapeutic options become widely available, or the Rona epidemic affecting the population subsides. Right. Given the limited resources and healthcare available to populations in humanitarian settings prior to the pandemic, it is unlikely sufficient hospitalization capacity, beds, personal protective equipment, ventilators, and staff will be achievable during widespread transmission. The national capacity in many of the countries where these are located, Chad, Myanmar, and Syria, is limited. Resources may become quickly overwhelmed during the peak of transmission and may not be accessible to the emergency affected populations. V trials are underway, but with no definite timeline. Reaching the suppression phase, where the epidemic subsides, can take several months, and cases may resurge in a second or even third wave. Herd immunity, the depletion of susceptible people for Rona, has not been demonstrated to date. It is also unclear if an infected person develops immunity, and the duration of potential immunity is unknown. Thus, contingency plans to account for possible extended operational timeline are critical. Other logistical consideration plan to identify additional resources and outline supply chain mechanisms to support green zones. Explanation. The implementation and operation of green zones requires strong coordination among several sectors, which may require substantial additional resources, supply, and staff to maintain these spaces: shelters, IPC, water, sanitation and hygiene, wash, no food items, NFIs, beds, linens, dishes, utensils, water containers, psychosocial support, monitors, supervisors, caretakers, attendants, risk communication and community engagement, security, etc. Considering global reductions in commodity shortages, movement restrictions, border closures, and decreased trucking and flights, it is important to outline what additional resources will be needed and how they will be procured. Protection consideration. Ensure safe and protective environments for all individuals, including minors and individuals who require additional care, whether they are in the green zone or remain in a household after the primary caregiver or income provider has moved to the green zone. Explanation. Separating families and disrupting and deconstructing multi-generational households may have long-term negative consequences. Shielding strategies need to consider cultural gender norms in order to adequately assess and address risks to individuals, particularly women and girls. Restrictive gender norms may be exacerbated by isolation strategies such as shielding. At the household level, isolating individuals and limiting their interaction, compounded with social and economical disruption, has raised concerns of potential increased risk of partner violence. Households participating in house swaps or sector-wide cohorting are at a particular risk for gender-based violence, harassment, abuse, and exploitation, as remaining household members may not be decision makers or responsible for household needs. Social, cultural, religious practices consideration. Plan for potential disruption of social networks. Explanation. Community celebrations, religious holidays, bereavement, funerals, and other rites of passage are cornerstones of many societies. Proactive planning ahead of time, including strong community engagement and risk communication, is needed to better understand the issues and concerns of restricting individuals from participating in communal practices because they are being shielded. Failure to do so could lead to both interpersonal and communal violence. Mental health consideration. Ensure mental health and psychosocial support structures are in place to address increased stress and anxiety. Explanation. Additional stress and worry are common during an epidemic and may be more pronounced with Rona due to the novelty of the disease and increased fear of infection, increased child care responsibilities due to school closures, and loss of livelihoods. Thus, in addition to the risk of stigmatization and feeling of isolation, this shielding approach may have an important psychological impact and may lead to significant emotional distress, exacerbate existing mental illness, or contribute to anxiety, depression, helplessness, grief, substance abuse, or thoughts of suicide. Among those who are separated or have been left behind, shielding individuals with concurrent severe mental health conditions should not be left alone. There must be a caregiver allocated to them to prevent further protection risks such as neglect and abuse. Holy cow. I just realized something. This was written, or updated, I should say, July 26th of 2020. But still, this is very, very interesting because who would have known that they even had something like this in place? I only knew about the law that they were trying to pass in New York. I had no idea that that they even had this in place. So I will leave the link in the description box below because I love to do that so you guys have a way to reference things and stuff like that, okay? So I'll see you guys in the next one. I love you. Stay safe, stay positive, keep prepping, and as always, fear less. I mean, I know sometimes it's hard to do that, with a lot of the information that gets put out there and stuff like that, but, better to be educated and know what's really out there, what's really going on, even if it's an older article, because I know sometimes I hear this a lot. That's old news. That's old news. A lot of times, it may be old news to some, but to a lot, we didn't know about it. I didn't know about this. Did you? Anyway, I love you. Catch you later.